Hey guys, welcome back in our YouTube channel in which we are going to discuss today about trigeminal nerve as a whole in one video. So trigeminal nerve is the fifth cranial nerve as we have two types of nerve in our body, cranial nerves and spinal nerves. And we have 12 pair of cranial nerves. Cranial nerves are for our head and neck region. In 12 pair of cranial nerves, we have olfactory nerve, then optic nerve, oculomotor nerve, trochlear nerve, trigeminal nerve, abducens nerve, facial nerve, vestibulocochlear nerve, glossopharyngeal nerve, vagus nerve, craniosensory nerve, and last but not the least, hypoglossal nerve. From these all 12 cranial nerves, some nerves are purely sensory. Purely sensory means they only take the sensation from the periphery region of head and neck region to the brain. And some are purely motor. That means they carry the response from the brain to head and neck region. But some nerves are such that they have both type of fibers, sensory as well as motors. And one of these nerve is trigeminal nerve. Trigeminal nerve is the fifth largest cranial nerve, which is of mixed type. Mixed means it has both sensory fibers and motor fibers. So, the sensory fibers of trigeminal nerve are the general somatic afferent fibers, and motor fibers of the trigeminal nerve are the special visceral efferent fibers. General somatic afferent fibers carry the two type of impulses, first of exteroceptive impulses and proprioceptive impulses. Exteroceptive impulses are mainly impulses of touch, pain, and thermal senses. And these impulses, exterotype impulses, mostly carry from the skin of the face and forehead, mucous membrane of nasal cavity, oral cavity, nasal sinuses, and floor of the mouth. Then teeth. And also it carried exteroceptive impulses are carried from the anterior two-third of tongue and extensive portion of the dura. The proprioceptive impulses, these are the impulses of deep pressure and kinesthesis. And these impulses conveyed from the teeth, periodontium, heart palates, and TMJ receptors. Impulses also from these touch receptors in the muscles of mastication. These are also the proprioceptive impulses. So our special visceral efferent fibers, these are the fibers which innervate the muscle of mastication, the tensor tympani, tensor belli parietii, muscles of eye, and facial muscles. Trigeminal nerve attached to the lateral part of the bone by means of two roots. First of all, small motor root, which is also known as the portio minor, and large sensory root, which is also known as the portio major. Both roots enter the middle cranial fossa, and sensory root take the signals from the periphery to brain, and motor root take the response from brain to body by exiting the middle cranial fossa. So sensory root enter the middle cranial fossa and motor root leave the middle cranial fossa. So the sensory root of the trigeminal nerve arise from the trigeminal ganglia, which is also known as the Gaussian ganglia or seminular ganglia. This ganglia is located in the macal cave, that is the extension of the dura mater containing the cerebrospinal fluid at the apex of the pitous part of the temporal bone. And this ganglia is of crescent shape and developed from the neural crest. It contains the unipolar neurons. So trigeminal ganglia has two processes. One is peripheral processes, other one is central processes. Three branches arise from peripheral processes. First is the ophthalmic, then maxillary, and then mandibular. The central process from the sensory root, from where the fibers enter the bones by making two tracks, ascending tract and descending fibers. So ascending fibers, descending fibers. Ascending fibers contain the impulses of touch, tactile discrimination, sense of position, and passive movements. These impulses coming from the periphery of the face, that is face, as the face or head and neck region is supplied by the trigeminal nerve. So impulses coming from these regions from the ganglia trigeminal ganglia, these impulses ascend to the main sensory nucleus of trigeminal nerve present in the upper pons. So, and you see trigeminal nerve have the nucleuses. So it has the upper main sensory nucleus, then it has spinal nucleus, then it has mesocephalic nucleus and motor nucleus. So upper main sensory nucleus is present in the upper pons where the sensations of touch, tactile discrimination, sense of position and pensive movements reaches. And these fibers are known as the ascending fibers. Here, in this nucleus, first synapse occur and second order neurons arises, which reaches the thalamus via dorsal trigeminothalamic tract. These fibers from the upper sensory nucleus cross the midline to the opposite side and reaches the thalamus through the medial lemniscus. Here in the thalamus, second synapse occur and third order neurons rises which reaches the cerebral cortex. So similar to ascending fibers, we have descending fibers. So descending fibers contain the impulses of pain and temperature. So these impulses, or you can say these fibers, synapse in the spinal nucleus. So spinal nucleus is also the trigeminal nucleus which extends from the caudally, from the upper main sensory nucleus to the second cervical segment. Here the first synapse occur in the spinal nucleus and second order neurons arises which form the ventral trigeminothalamic tract and which is the thalamus to the of the opposite sides. In the thalamus, second synapse occur and third order neurons arises which reaches the cerebral cortex. So impulses reaches cerebral cortex by means of dorsal trigeminothalamic tract and ventral trigeminothalamic tract or ascending fibers or descending fibers. All the impulses, rather of touch, pain, ultimately they reaches the cerebral cortex. From Then comes to the motor root. Motor root rises from the motor nucleus in the upper pons and fibers passes from the pons along the medial side of semilunar ganglia. Then these fibers, motor fibers, run side by side with the mandibular division, that is of the trigeminal ganglia, without joining it. So both mandibular division and motor fibers exit from the skull through the foramen ovale. Then they join to form a single trunk. Then they give up two branches. First branch, that is to the dura mater, which is known as the nervus spinosus, and second branch, which is to the nerve to medial pterygoid or internal pterygoid muscle. Then these divide into the two divisions. First is anterior division and another one is posterior division. Now come to the mesocephalic root. This root contains the afferent fibers which run along the motor root. These afferent fibers have the sensation of proprioception or kinesthetic movements. So these sensations coming from the hard palate, pydoncium, then teeth or TMJ. So these impulses to the pons from the peripheral division of the trigeminal ganglia, mainly from the mandibular division of the trigeminal ganglia. Then these sensations of proprioception or kinesthetic movements, these ascend to the mesocephalic nucleus of the trigeminal nerve, which is in the midbrain, and then here no synapse occur. Without delaying, these fibers pass to the upper sensory nucleus. Then synapses occur in the upper main sensory nucleus of the trigeminal nerve. Then second order neurons arises, which follow the same pathway as the sensation of touch, tactile discrimination, or sense of positions follow. And these make the dorsal trigeminothalamic tract. So they ascend to the thalamus by means of the dorsal trigeminothalamic tract by crossing to the opposite side through the medial meniscus. Then second synapse occur in the thalamus, third order neurons arises which reaches the cerebral cortex. So this is picture which showing the trigeminal ganglia with its three peripheral divisions. First one is ophthalmic, second one is maxillary, which is middle one, and third one is mandibular. From these divisions, the fibers of touch or tactile discrimination, mainly apical fibers, and touch or tactile discrimination fibers are mostly myelinated fibers. So these myelinated fibers, they reach the trigeminal ganglia by taking the impulses and from the periphery of the face or head and neck region, and this is from the ganglia. These pass by the central root and they make the ascending fibers and they ascend to the upper main sensory nucleus of the trigeminal nerve. From the from the then proprioception fibers, that are the from fibers from the PDL, TMJ, or heart palate or teeth. These fibers, mesospally fibers, that is the fibers of the pressure or kinesthetic movements, these fibers pass by along with motor root and they enter same way they enter the trigeminal ganglia, and they also ascend, but they ascend to the mesocephalic nucleus, and from there without relay there or without any synapse they extend downward in the main sensory nucleus and synapse occur here. Then the sensations of the pain, temperature, they are carried by the C fibers. Then they are unmyelinated fibers and they descend to the spinal nucleus, which is caudal to the main sensory nucleus till the second main cervical segment. And here the in spinal nucleus synapse occur, and these are the descending fibers. And from these all five nucleuses, the second order neurons arises. The second order neurons then fibers travel and goes to the opposite side, which is the thalamus. And from the thalamus, third order neurons arises and which reaches the cerebral cortex. Now the motor nucleus present in the present anteromedial to the upper main sensory nucleus, from where the motor response arises, and this motor response travel along the motor route and they travel along with the mandibular division of the trigeminal ganglia, and they both mandibular division and motor route run side by side, and they exit from the foramen ovale. From the foramen ovale, after exiting they form a single branch from where two main branches arises. One is the branch to the cerebral dura and second is the branch to the internal pterygoids. Then is further divided into anterior and posterior divisions, and from the anterior divisions, motor fibers mostly, impulses mostly arises, and from posterior division mostly sensory impulses arises except to the impulse to the myofibrotic muscle, that is the motor. And the similar way anterior division, motor impulses arises except to the buccinator muscle, that is the long buccal, which is sensory. So now we are going to discuss the divisions of the trigeminal nerve. Trigeminal nerve has three main divisions, which is first of all ophthalmic division, which arises from the anterior medial part of the trigeminal ganglia, then and is purely sensory division. Then maxillary division, which is also purely sensory division, and it is rises from the middle portion of the trigeminal ganglia. Then is the mandibular division, which is mixed division, both sensory and motor fibers, and arise from the third portion of the trigeminal ganglia. Now, ophthalmic division, that is the sensory division, leave the middle cranial fossa through the foramen rotundum, and it give a dural branch, which is known as the nervus tentori. Then maxillary division also leave the middle cranial fossa through the foramen rotundum, and it gives a nervous dural branch, which is the medial meningeal nerve that run along the medial meningeal artery. Mandibular division, which contain both sensory and motor fibers, leave the middle cranial fossa through the foramen ovale, and it give the dural branch after leaving the foramen ovale, exiting from the middle cranial fossa. Then that nervous branch or the dural branch is known as the nervus spinosus, which re-enter the middle cranial fossa through the foramen spinosum. So this mandibular division leaves through the foramen ovale, then this dural branch re-enter the middle cranial fossa through foramen spinosum. So ophthalmic division that these all three divisions supply the different areas of the face, which are we are going to discuss turn by turn. First division is ophthalmic division of the trigeminal nerve. It's a purely sensory nerve and smallest from other divisions, and it leaves the anterior-medial part of the ganglia. Then it passes forward in the lateral wall of the cavernous sinus and leave the middle cranial fossa by entering the orbit through the superior orbital fissure. Areas from where sensations carried by the ophthalmic divisions are the scalp, skin of forehead, upper eyelid lining the upper eyelid and lining the of the frontal sinus, conjunctiva of eyeball, lacrimal gland, skin of the lateral angle of the eyeball, sclera of the eyeball, lining of the ethmoidal cells. So here in this diagram is clearly shown the ophthalmic division which leave from the anterior medial part of the trigeminal ganglia. It gives the meningeal branch which supply the dura as the all the three branches give one dural branches as trigeminal nerve supply the extensive portion of the dura. Then this main nerve enter the run in the cavernous sinus and it give communicating branches to third cranial nerve, fourth cranial nerve and sixth cranial nerve. Then it divides into three branches, lacrimal nerve, frontal nerve or nasociliary nerve, and then these three branches enter the orbit through the superior orbital fissure. So first of all, lacrimal nerve. Lacrimal nerve is the smallest from other two nerves and it passes into the orbit through the at the lateral angle of the superior orbital fissure. In this diagram is clearly shown lacrimal nerve entering the orbit and it causes anterolateral to supply the sensory fibers to gland and adjacent conjunctiva. Lacrimal nerve contains sensory fibers, but along with sensory fibers, the fibers which are the postganglionic secretory fibers from the spinopalatal ganglia, which travel through the zygomatic nerve, and this zygomatic nerve near the lacrimal nerve, and through the lacrimal nerve, these postganglionic secretory fibers also supply to the lacrimal gland. Then frontal nerve, which is the largest from these two, which is largest from the frontal and from the nasal. Frontal nerve, which is the largest, or you can say it is a direct continuation of the ophthalmic division and ophthalmic division of the trigeminal nerve. So frontal nerve also enter the orbit by means of superior orbital fissure, and in the middle of the orbit it divided into two branches, supraorbital and supratrochlear. Supraorbital is largest and passes forward, leave the orbit through the supraorbital foramen or notch and supply the skin of upper eyelid, forehead, anterior scalp region to the vertex of the skull. Supratrochlear nerve is the smallest, passes toward the upper middle angle of the orbit, passes the fascia of upper eyelid and supply the skin of the upper eyelid and lower medial portion of the forehead. Then nasociliary nerve, which is the third main branch of the ophthalmic division and so enter the orbit by the superior orbital fissure. Nasociliary nerve have branches in the orbit, branches in the nasal cavity and terminal branches on the face. It has branches in the orbit, four branches mainly. First is the long root of the ciliary ganglia. Then long ciliary nerve, posterior ethmoidal nerve, anterior ethmoidal nerve. So long root of the ciliary ganglia, which has the sensory fibers and it arises from the nasociliary nerve. And the sensory fibers through this long root of ciliary ganglia reach the ciliary ganglia without synapsing in the ciliary ganglia. They supply the continue on eyeball through the short ciliary nerves. These short ciliary nerves also contain parasympathetic fibers. And the postganglionic parasympathetic fibers and sympathetic fibers also. Then we have long ciliary nerves. long ciliary nerves are 2 or 3 in number, and they supply the iris and cornea. Then posterior ethmoidal nerve, which passes through the posterior ethmoidal canal to supply the posterior ethmoidal cells and sphenoid sinus. And then anterior ethmoidal, which run along the medial wall of the orbit, and its filaments supply the anterior ethmoidal cells and frontal sinus. And so these are the long root of ciliary nerve, long ciliary nerve, and posterior ethmoidal nerve and anterior ethmoidal nerve. Anterior ethmoidal nerve then supply into two branches: internal nasal branch for the nasal septum and external nasal for the end of the nose. So internal nasal branch, which also again split into two branches, septal or lateral. Septal branch for septal area or lateral branch for the medial or superior concha. Then external nasal branch, which supply the tip of the nose, angle of the nose, and bridge of the nose. Then branches in the nasal cavity. So in the nasal cavity, the ophthalmic division supply the mucosa of the nasal cavity, and it gives some terminal branches also on the face, which on the face we supply the eyelids, branches to eyelid, branches to lacrimal sac, lacrimal frontal, or skin over the side of the bridge of the nose. So this is all about the ophthalmic division of the trigeminal nerve. Hey guys, welcome back to our YouTube channel, and today's our topic of discussion is maxillary division of trigeminal nerve. In previous two sessions, I have discussed with trigeminal nerve the introduction of trigeminal nerve, in which I have told you that trigeminal nerve is a mixed cranial nerve and it is the largest cranial nerve. And I have told about the three divisions of trigeminal nerve, that is ophthalmic, maxillary, and mandibular, in which I have explained now ophthalmic division. And now today I am going to explain the maxillary division of trigeminal nerve. The maxillary is the second division of the trigeminal nerve. It is the purely sensory division, and it begins at the middle of the semilunar ganglia, continue forward in the lower part of the cavernous sinus, and leave the middle cranial fossa through the foramen rotundum to enter into the pterygopalatine fossa. After entering the pterygopalatine fossa, it gives some branches, and then it runs forward to leave the pterygopalatine fossa through the inferior orbital fissure, enter the orbit. In the orbit, it runs in the infraorbital groove and give mainly two branches, anterior superior alveolar and middle superior alveolar nerve. And in the infraorbital groove, it's known as the infraorbital nerve, and then it exits through the infraorbital foramen to give its terminal branches. So this is the picture showing the pterygopalatine fossa, where the pterygopalatine ganglia is placed or located. It contains sphenopalatine foramen, through which the branch of the pterygopalatine ganglia, nasopalatine branch, enters. And this fossa is present between the pterygoid plate and palatine bone. The areas supplied by the maxillary division of the trigeminal nerve are mostly lower eyelid, side of the nose, upper lip, maxillary teeth and their gingiva, mucous membrane of nasal cavity, hard and soft palate region, part of tonsillar region, and region of the pharynx near the opening of the auditory tube. Just like lower eyelid is supplied by the inferior papillopular branch of the maxillary nerve, side of the nose by the lateral nasal branch, upper lip by the superior labial branch, maxillary teeth in anterior superior nerve, and bicuspid by the middle superior alveolar nerve, and posterior molars by the posterior superior alveolar nerve along with their gingivas, hard palate, anterior 1/3 by the nasopalatine, and posterior by the greater palatine, hard palate, soft palate by means of lesser palatine nerve, which is the middle palatine, and tonsillar region by the posterior palatine, and pharynx by the pharyngeal branch, which is the branch of the pterygopalatine ganglia. So these are the areas supplied by the branches of the maxillary division of the trigeminal nerve. Now comes to the branches of the maxillary division of the trigeminal nerve. First branch is the dural branch. So when the maxillary division leaves the middle cranial fossa through the foramen deprindum, before that it gives dural branch, which is known as the middle meningeal branch, which run along with the middle meningeal artery. Then it enters the foramen rotundum, and first it gives the zygomatic branch, that is the zygomatic nerve, which leave the pterygopalatine fossa and enter the orbit through the inferior orbital fissure. In the middle of orbit, it divides into two branches, zygomatico-orbital and zygomatico-temporal. Zygomatico-orbital or zygomatico-facial nerve passes forward on the lateral orbital foramen and leaves by pursing the orbicularis oculi muscle and supply the sensitive fibers to the skin over the prominence of the zygomatic bone. Similarly, zygomatico-temporal nerve, which is second branch of the zygomatic nerve, leaves the orbit by passing through the zygomatic bone and create a link of the sphenoid bone to enter the temporal fossa. Here it supplies sensitive fibers to the skin over the anterior temporal fossa region. Now, after giving the zygomatic branches, it maxillary division give the pterygopalatine nerves. These are the two short nerve trunks which unite at the pterygopalatine ganglia. In pterygopalatine ganglia, no synapse occur and the fibers redistributed into several branches, in which the branches mainly go orbital branches, palatine branches, or nasopalatine branch or sphenopalatine, or pharyngeal branches, and one branch is like fibers go back into the pterygopalatine nerves through relay back into zygomatic nerve, and then zygomatic nerve meet the lacrimal nerve, and then fibers reaches the lacrimal gland. These are the post-ganglionic secretomotor fibers to lacrimal gland. So, secretomotor supply of lacrimal gland is as such. Preganglionic fibers reaches these pterygopalatine ganglia or sphenopalatine ganglia through the greater superficial pterygopalatine nerve. Here, relay of fibers occur. Then postganglionic fibers arises. They run back into the pterygopalatine nerves of the maxillary division. Through them, they travel back in the maxillary division, then to zygomatic nerve, and then zygomatic nerve meets the lacrimal nerve. The fibers run into lacrimal nerve, and via that they reach the lacrimal gland. So, lacrimal nerve, along with supply the sensory supply to lacrimal gland, but along with that, it also supply the secretomotor supply. Then, other pterygopalatine branches are the palatine branches. Palatine branches, first of all, greater palatine nerve, or we can say anterior palatine nerve, which is which supply the maxillary molars along with their palatal gingivas, and it run forward course. Then middle palatine nerve supply the soft palate, and posterior palatine nerve supply the tonsillar area. Then ganglionic branch is also given to pharynx, that is the pharyngeal branch. Then we have nasal branches which go into the spinopalatine foramen. And then we have some orbital branches which enter the orbit by the inferior orbital fissure and supply the periosteum of orbit and mucous membrane of the part of the posterior ethmoidal cells and sphenoid sinus. Then comes the posterior superior alveolar nerve. So it is also given in the pterygopalatine fossa. It runs downward and continue on the posterior surface of the maxilla, and it run through the posterior superior alveolar canals and supply the posterior wall of the maxillary sinus and maxillary molars along with their gingivas. Then, after giving these three branches, that is zygomatic, posterior superior, or pterygopalatine branches, the maxillary nerve take its further forward course, enter the orbit through the inferior orbital fissure, and turn in the infraorbital groove or canal. Here, it gives two branches, anterior superior alveolar nerve and middle superior alveolar. So comes to the middle superior alveolar nerve, which join with the other alveolar nerves to form the superior dental plexus. If middle superior alveolar nerve leaves the infraorbital nerve in the posterior part of the floor of the infraorbital canal, then it passes in the downward and anterior direction toward the apices of the bicuspid and supply them. If it leaves the infraorbital nerve in the floor of the infraorbital canal near the infraorbital foramen, then it passes downward in the anterior direction and supply the anterior lateral wall of the sinus, maxillary sinus. And sometime in middle superior alveolar nerve is missing. Then bicuspid receive the sensory innervation from the superior dental plexus. After middle superior alveolar nerve, infraorbital give the anterior superior alveolar nerve branch, which descend from infraorbital nerve inside the infraorbital foramen in the anterior part of the infraorbital canal, and it supplies the central, lateral, or cuspid, and also gives some connected fibers to superior dental plexus, and it also supplies the mucous membrane of the anterior part of the maxillary sinuses. Then infraorbital nerve leaves through the infraorbital foramen and gives its terminal branches. First is the inferior palpebral branch to the lower eyelid, then external nasal branch to the skin of the side of the nose, and then superior labial to the skin of the upper lip. So this is all about the maxillary division of the trigeminal nerve. Hey guys, welcome back in our YouTube channel in which we are studying about trigeminal nerve, and today's our topic of discussion will be the mandibular division of trigeminal nerve, which is the third main division of trigeminal nerve. As in previous section, we have discussed about the other two divisions of trigeminal nerve, which are the ophthalmic and maxillary division of trigeminal nerve. The mandibular division, which we are going to discuss today, is a mixed nerve. It's largest from other two divisions, and it's mixed because formed by the union of small motor and large sensory root. So this mandibular nerve is mixed because of its sensory and motor root. This here is a diagram showing that sensory root arises from the third peripheral division of the Gasserian ganglia, trigeminal ganglia, and motor root arises from the motor cells in the medulla oblongata. Motor root run along with the sensory root, passes below the semilunar ganglia, and run side by side. This sensory root, but not join. They both pass through the foramen ovale to leave the middle cranial fossa, then join to form the single trunk, and after running a small course, it divides into two divisions, anterior division and posterior divisions. This sensory supply of this nerve is to dura. As I have discussed before, all three divisions of trigeminal nerve give one dural branches to the dura mater, and then its a sensory supply is also to skin and mucous membrane of chin, cheek, and lower lip. Then external ear, parotid gland, TMJ, scalp over the region of temporal bone, and then lower teeth and gingiva. And its motor supply to muscle of mastication, mylohyoid muscle, anterior valley of digastric, tensor valley balti, and tensor tympani. As the dura mater, the sensory supply is given by its dural branch, which is the nervus spinosum. And skin and mucous membrane of chin, cheek, and lower lip are supplied by its posterior division. Then external ear, parotid gland, TMJ, they are also supplied by its scalp over the temple region of the temple region. They are also supplied by the posterior division, auriculotemporal nerve, which is a branch of posterior division. Then lower teeth and gingiva by inferior velar nerve, which is also the branch of posterior division of the mandibular nerve. Then is motor supply to muscle of mastication, mylohyoid, extra. These are by the anterior branch of the mandibular division of the trigeminal nerve. So both divisions supply sensory and motor supply to the various parts of the face. Branches of the mandibular nerve are branches from the first of all main trunk, the meningeal branch and up to medial pterygoid. Then branches from the anterior trunk are the buccal nerve, mesenteric nerve, deep temporal nerve, and nerve to lateral pterygoid muscle. Branches from the posterior division are the auriculotemporal nerve, lingual nerve, and inferior velar nerve. Here is the diagram showing the complete course of the mandibular division of the trigeminal nerve, in which we are seeing this green line, which is the peripheral division, third peripheral division of trigeminal ganglia. This is the sensory root, sensory part you can say, motor part coming from the motor cells which are present in the medulla oblongata. Both nerves, sensory or motor fibers, both fibers run side by side. Motor fibers pass below the semilunar ganglion, run along the sensory part, though both side by side, crossing the foramen ovale, and just after crossing it, they join to form the single trunk. So then first sensory branch arises from the single trunk, which is the meningeal branch, that is the branch to dura mater, and this branch has the name nervus spinosum. And this nervus spinosum then entered back into the middle cranial fossa through the foramen spinosum to supply the dura mater. Then second branch, which is the motor branch, arise from this single trunk, are the nerve to medial pterygoid. This nerve to medial pterygoid supply the medial pterygoid muscle, and also some fibers pass through the tensor tympani muscles and tensor varii peltae muscle. Then the single trunk course further forward and divide into two divisions. First is anterior division and then posterior division. Anterior division supply the mainly muscles of mastication, and then posterior division have three main nerves. First is auriculotemporal, then lingual, and then inferior alveolar nerve. And when it giving the inferior alveolar branch just below, with that, it also give a nerve to mylohyoid muscle, that is the mylohyoid nerve. So inferior alveolar canal enter the mandibular canal, inferior alveolar nerve enter the mandibular canal, and nerve to mylohyoid run downward. Now I am going to discuss each nerve turn by turn. First of all, we are going to start from the anterior division of the divided mandibular nerve. The first nerve is nerve to external pterygoid or lateral pterygoid muscle, which enter the lateral or external pterygoid muscle from the medial side. Second is the nerve to temporalis muscle, which are the two nerves, anterior deep temporal nerve and posterior deep temporal nerve. Anterior deep temporal nerve passes upward and crosses the infratemporal crest of the sphenoid bone and enter the deep part of the anterior portion of the temporalis muscle. Then posterior deep temporal nerve runs upward to the deep part of the temporalis muscle. Then the nerve to the masseter muscle. Nerve to masseter muscle passes above the external pterygoid muscle, then enter the mandibular notch, and from that it enters the deep part of the masseter muscle. Now come to the buccal nerve. Buccal nerve run downward anteriorly and laterally between the two heads of external pterygoid muscles. At the level of occlusion plane of the mandibular second and third molar, it divides into several branches to supply the buccinator muscle. The nerves from the posterior division of the trigeminal nerve, that is first of all is the auriculotemporal nerve. Auriculotemporal nerve arises by the two roots. One is medial and then lateral. These both roots embrace the medial meningeal artery and join behind it and passes posteriorly deep to external pterygoid muscle. And then between the sphenomandibular ligament and neck of the condyle, then it traverses the upper deep part of the parotid gland, and after that it crosses the posterior root of zygomatic arch, run in upward course along with superficial temporal branches, and give to trachea of the pinna of the external ear, scalp about the ear, and buttocks of the skull. So, branches of the auriculotemporal nerve are mainly communication branches of auriculotemporal nerve. The communication branches have the communicative fibers, and these have the postganglionic parasympathetic secretory fibers. And second are the communicating branches of postganglionic sympathetic fibers. And third one is communicating branches to facial nerve, which are the sensory fibers. So these three types, parasympathetic, sympathetic, and sensory. Postganglionic parasympathetic, postganglionic sympathetic, and sensory fibers go into the parotid gland. The parasympathetic fibers, secretomotor fibers, they are postganglionic because their preganglionic fibers are from the glossopharyngeal nerve, and there is the otic ganglia, and from otic ganglia fibers run into the auriculotemporal nerve, and then communicating branches of postganglionic sympathetic fibers also go into the two roots of the auriculotemporal nerve and then into the parotid gland. Now, the other branches of auriculotemporal nerve are the branches to parotid, auricular, middle, and articular and terminal branches. So these are the auricular temporal nerve. Now comes to lingual nerve. Lingual nerve is a smaller nerve, and it also arises from the divided portion from the posterior division of the mandibular nerve, and it is smaller and passes medially to the external pterygoid muscle. Then it passes medially, then it runs downward between the internal pterygoid and ramus or mandible in the pterygomandibular space, where it lies anteromedial to inferior alveolar nerve, and it also gives a small branch to inferior alveolar nerve which supply the tonsillar region. Then it passes deep to the side of base of the tongue, where it lies below the lateral lingual sulcus. Here it separated from the tongue by alveolingual groove, and then it runs downward and immediately beneath the submandibular duct. It gives sensory fibers to mucous membrane of the floor of the mouth and gingiva on the lingual side of the mandible. Then branches of the lingual nerve. First is the communications of lingual nerve with coda tympani branch of the facial nerve, as the nerve passes medial to the external pterygoid muscle. Comes to the inferior alveolar nerve. It is the largest nerve or largest branch of the posterior division of the mandibular nerve of the, which is a branch of trigeminal nerve. It passes downward on the medial side of the external pterygoid muscle and the medial side of the mandibular ramus. And then it gives first mylohyoid branch before entering the mandibular foramen, which run downward and forward in the mylohyoid group to supply the mylohyoid muscle. It has both sensory and mixed sensory and motor fibers. Then it inferior alveolar nerve enter the mandibular foramen and run in the inferior alveolar canal. At the level of the bicuspid, there is a mental foramen from which is one branch, that is mental branch, comes out to supply the lower lip, skin of chin, and further it continue forward, inferior alveolar further continue forward as an incisive nerve to supply the central incisors. So this is all about the mandibular division of the trigeminal nerve. Hope you all understand, and if you have any query regarding this, you are free to ask. Thank you and have a nice day.